Okay, and Charlotte, make you the host now?
Yeah.
Yes, okay. Okay, you're good to go.
We can do a check to make sure that the recording is working if you guys would like.
Sure.
Seems to be working.
All right.
We're still waiting for everyone to join and then we'll get started.
Charlotte, can you go ahead and make me a co-host in case I fall off?
Yeah.
Drop off.
Charlotte, this is Kelly. Will I be able to scroll through my slides? Share my screen?
Let me make you a co-host. And then you should be able to do it when your presentation comes up.
All right, thank you.
We're just waiting for everybody to join and then we'll get started. Hi, Meredith. We're just waiting for the committee members to hop on before we can get started.
Sure, no problem.
We have Harvey and Erica, and we need one more person for a quorum. Oh, there's Carla. Just gonna give it one more minute to see if Diana hops on. Okay, we'll go ahead and get started. I can go over the instructions and then hopefully Diana will be able to join, and if not, I'll just continue through the meeting. Good afternoon. This is a meeting of the Nutrition Special Committee of the Commonwealth Council on Aging. Due to the active state of emergency in the COVID-19 pandemic, this is an electronic meeting pursuant to item 4-0.01 of the 2020 Appropriation Act. Meeting notice has been provided. The meeting is being recorded and minutes are being taken. All votes will be conducted via a roll call of voting members. Meeting materials are posted on the Council on Aging's webpage at the link posted in the slide. Members of the public are able to live stream the meeting via the DARS YouTube page. Please be advised that if the live stream is interrupted, we will need to pause the meeting until it is restored. Public comment for the committee will be accepted by email or phone to my attention. Public comments that were received by April 6th will be read, or if lengthy, summarized during the meeting. If you would like to make a public comment specifically about today's technology, usability, and access, please email me and I will send you the FOIA Council form and instructions for how to do so. We actually do not have captions for today's meeting. Working through the Zoom functions, members, please keep your microphone on mute unless you're speaking. This helps reduce background noise. Also, before you speak, please state your name. It helps your colleagues on the committee know who's talking, and it helps with documenting the minutes. This will be particularly important as committee members will be discussing recommendations and action items later in the meeting. If you have your video enabled, please be aware that the system may capture your image and video in the public streaming and in the recording. You can use the chat feature as well. That's being monitored by Elizabeth and, to the degree feasible, myself. We do not have captions for today's meeting. You can set some view options yourself in this right corner, and then other features will be set by the host. I would like to thank the DARS video teleconferencing team and the DARS communication team for making this electronic meeting possible. And with that, I will turn it over to Diana.
Welcome everyone to the meeting today. Charlotte, please conduct a roll call for the committee members to determine if we have a quota. Please, members, indicate your presence and introduce yourself when Charlotte calls your name.
Thank you. Harvey Chambers.
Harvey Chambers with Anthem Health Keepers Plus. I'm here.
Carla Hesseltine. Carla, you're muted.
Sorry, I'm Carla Hesseltine from Virginia Beach, and I'm just an elderly advocate.
Thank you. Diana Pagawa.
Diana Pawaga, here from Woodbridge, Virginia.
Okay. Erica Wood.
Hi, yes, Erica Wood from Arlington, Virginia. I chair the council's legislative committee.
And then ex officio Beverly Sobel.
Thank you, Charlotte. Beverly Sobel, Chair of the Commonwealth Council.
There is a quorum present for today's meeting.
Thank you. Thank you. We also have Thelma Bland Watson, representing the Virginia Association of Area Agencies on Aging and the AAA perspective for this committee's work. Thelma, would you like to introduce yourself?
Thelma, can you hear us? Can anybody hear me?
Yes, I can hear you.
Okay. All right. Sorry, we're having some technical difficulties on the back end too. Also present for today's call, and I'll let them introduce themselves. Kathy Miller.
Good afternoon. I'm Kathy Miller. I'm the Director of Aging Programs and Services at DARS.
Thanks, Kathy. Kelly Wright.
Good afternoon. My name is Kelly Wright. I am the Nutrition Program Coordinator at DARS.
Thanks, Kelly. We also have David Rosenheimer, Betsy Civilette, and Cecily Slazer, who are helping support, along with Elizabeth Pataka, who's monitoring the chat. Diana, I can report that there was no public comment received for today's meeting.
Awesome. Okay, this time we need to approve the agenda. Does anyone have anything they would like to add to the agenda, or is there a motion to approve the agenda as presented?
This is Erica. I move to approve the agenda as presented.
This is Harvey, I second.
Okay, Charlotte, could you conduct the roll call for the vote?
Yes. Just Elizabeth, or just somebody have the phone number for the, Elizabeth, do you have the phone number to call into the meeting for the Zoom that you can send me in a direct message?
Yes, I will send it to you.
Thank you. Okay, this is a roll call vote for the to approve the agenda. Harvey Chambers.
Aye.
Carla.
Aye.
Diana.
Aye.
Erica.
Aye.
And Beverly, you only vote if there's a tie.
Thank you.
So the agenda was approved.
Awesome. The December 7th, 2020 meeting minutes have been provided to members and for the public, and they are posted on the council's webpage. Are there any corrections to the December minutes?
I think you can ask for the motion. if you'd like.
Motion to, is there a motion to approve the December minutes?
This is Harvey. I move for the approval of the minutes for the December meeting.
This is Erica. I second that.
Charlotte, please conduct the roll call for the vote.
This is a vote to approve the minutes from December. Harvey,
Aye.
Carla,
Aye.
Diana,
Aye.
and Erica.
Aye.
The motion is approved.
Okay, so moving into the meat of the agenda today, we are pleased to have Meredith Ponder with us. Meredith is the policy director for Defeat Malnutrition Today. Defeat Malnutrition Today is a coalition of over 100 organizations and stakeholders working to defeat older adult malnutrition.
You entered 88957619536. This meeting ID does not exist. Please re-enter your meeting ID followed by pound.
Thelma, I think we can hear you now.
Okay, the goals of the coalitions are to achieve the recognition of malnutrition as a key indicator and vital sign of older adult health risk. And second, work to achieve a greater focus on malnutrition screening and intervention through regulatory and or legislative change across the nation's healthcare system. Meredith heard about the council's interest and work on the topic of nutrition and reached out to us. We are excited to have her with us to share her experience and expertise.
You can mute or unmute yourself by pressing *6. You have been added to the waiting room. You are unmuted.
Thelma, can you hear us?
Yes, I hear you, Charlotte. Thank you. Can you hear me?
Yes, Thelma.
Thank you.
I'm sorry, Meredith, if you don't mind, could Thelma introduce herself really quickly?
Of course, go ahead.
Thank you so much. I'm sorry to be a few minutes late. Thelma Watson, Executive Director of Senior Connections, the Council Area Agency of Aging, serving as an ex-official member of the Commonwealth Council on Aging, representing the Virginia Association of Area Agencies on Aging, D4A. Thank you.
Thank you. Diana, I'm sorry, I missed it. Did you finish your introduction of Meredith?
Yes, I did.
Okay, Meredith, you're all set to start if you'd like. Thank you for joining us today.
Sure, no problem. I'm excited to be here. I'm actually also a Virginian. I live in Arlington. So the work of this council is near and dear. And one of my colleagues is Bob Blancato, who was on the council and who told me to say hi to Erica. So hi, Erica. I hope you're doing well.
Hey, Meredith. I'm so glad to see you, and say hi to Bob.
All right. So next slide. I'm just going to give you a little overview of the short presentation. I think we've already covered what DMT is, but I can flip through that slide pretty quick. I wanted to give you a very quick, I realize this is a state council, but a very quick highlight of what has happened at the federal level with regard to pandemic policy. I know that will also be covered a little later, so I'm not going to go terribly far, but just wanted to say. And then talking about what states can do on the malnutrition front and showing you some of our new and improved resources. So next slide. Who is Defeat Malnutrition Today? Next slide. So we're a coalition of over 100 national, state, and local stakeholders and organizations. So all kinds of groups. We have, groups like the Academy of Nutrition and Dietetics. We have groups like N4A. We have some of the state area agency associations. We also have some of the local meals programs are interested. And we actually have some corporate members, who are very interested in the topic of nutrition. So one of our real goals is to work to create policy change. So that's both federal and state. So next slide, I will talk about some of the federal stuff that's happening. I will show you an infographic. I'm sorry. So as you know, malnutrition is a serious issue. and you know, just some of the stats here. You can also find those stats. I know that you all have, you know, based on the minutes from the last meeting, seen the blueprint and some of our other resources on our website, and I was really excited to see that, which is why I contacted Charlotte. So all of you are pretty familiar with these stats, and we will move on. So the pandemic is pretty much the elephant in the room that you have to acknowledge. It's, you know, it has created a marked decrease in nutrition security for millions of people, all ages. Some of the estimates show that food insecurity rates have doubled across the country, particularly for younger folks, you know, with job losses and that kind of thing. But it's, you know, it's not really limited to the younger population. You know, we've seen the incredible demand for senior nutrition programs, Meals on Wheels, the incredible demand for SNAP, and just, you know, all these serious issues around nutrition security. We don't have a lot of data on malnutrition in particular. That is partially because, you know, as I'm sure most, if not all of you know, local nutrition programs do intake screenings and determine folks' nutrition risk. And in a lot of places that the intake screenings were not happening immediately. You know, it's been more about feeding people than it's been about necessarily filling out paperwork. So, you know, we anticipate finding out some data, but we don't know quite yet. Next slide. So in the new federal relief package, this is slightly off. It's 1.4 billion. I'm sorry for the typo, in Older Americans Act funding, including 750 million for Older Americans Act nutrition programs. It also continues the 15% increase in SNAP benefits for folks through September 30th. And something I think is really exciting, it also contains funding for technical assistance and technology for some of the SNAP online purchasing programs. You know, that was a pilot that started with just a handful of states, and it has expanded to basically every state, that folks can now use their EBT benefit stuff online and can order, you know, at quite a few retailers now online. And so we just thought, you know, to highlight that, because for older adults in particular, delivery has been exceedingly important, you know, due to social distancing and, you know, mobility issues that might have already existed. So, you know, that's something that we are particularly pleased about. Next slide. So some of the things that states can do, just pulled from the blueprint and just in general, you know, support federal programs with adequate state resources. And by that, I mean, not only like the matching funding for the federal programs, but also, you know, outreach funding to make sure that folks know that these programs exist. Also implementing malnutrition screening standards into things like Medicaid programs, departments of health issues, and integrating malnutrition screening into various state plans that might exist on diabetes, obesity, falls prevention, et cetera. And also, you know, at the state level, trying to create some of that, you know, that malnutrition screening. That's something I actually, you know, am interested to see what's happening. The Older Americans Act was reauthorized last year, and it includes, for the first time, that nutrition screening should include malnutrition screening. And that's up to different states to implement how they choose. That's not necessarily a federal decision as to screening tools. So, you know, I'm hoping that states across the country are going to be implementing that, you know, in using some of the validated screening tools. And then, you know, there's also the option of establishing third-party campaigns, including through public-private partnerships, to educate the public and providers on malnutrition and, you know, nutrition security and how important it is for good health. Next slide. So we have a ton of updated resources that you may or may not have seen on our website. We updated the national blueprint last year, which was a good time. It was early spring, so we know even more about the pandemic now than we did in May. But we did make sure to get some of that in there because we were, any policy document that doesn't talk about the pandemic at this point is pretty outdated. And any policy document that, is published in 2020 that doesn't take that into account, just isn't relevant in a lot of places. So we also last spring created a COVID-19 resource page, which is available through our main menu on our website. We have a page specifically dedicated to state advocacy. We have forums for folks to post in. And then we've broken our resources up into professional resources. So things for clinicians, things for folks who are really interested in diving deep into the issue of malnutrition, but also patient resources and links to places that folks can get SNAP benefits, or they can find their local Older Americans Act programs. So that's been pretty popular as well. Next slide. So as I said, we updated the blueprint, which you guys have seen, and it was an exciting process. Next slide. This is an example of one of the maps on our patient resources page. If you click on it, on each state, it links to each state's Older Americans Act programs. And this was a labor of love to put together. It was really fun. Next slide. This is the same thing, but with the SNAP programs. Next slide. This is an update to our state malnutrition policy infographic. We're almost done with an update to the state legislative toolkit itself, but we've already got the infographic updated. Next slide. So we, with malnutrition action at the state level, a lot of that last year included things like acknowledging Malnutrition Awareness Week and, conducting campaigns around that. Or we had folks establishing commissions or adding duties to study nutrition to their already existing health commissions for the first time. That has happened in the past year or so as well. Virginia was pretty much a pioneer on that front, and there's legislation pending in a couple of states right now. So we're really excited about that. Next slide. So here are some resource links, and all of this is available through our main website as well. So it's pretty easy to navigate. And that is the end.
Thank you so much, Meredith. Thank you so much. So now, so we are now as brief update on Medicaid and adult dental benefits. As committee members may remember, the Council on Aging, along with many other groups and organizations, advocated for the creation of adult dental benefits in Medicaid. This work was successful, and the Department of Medical Assistance Services, with the authority from the General Assembly, has created this new benefit. Dental hygiene is an important component of quality nutrition, and we are glad to see that this service is now available in Medicaid. We have asked Kathy Miller, Aging Programs Manager with DARS, to provide a brief update on the rollout of these new Medicaid benefits. Kathy?
Thank you, Diana. Yes, I'm going to talk for just a couple of minutes about the new adult dental benefit that will become effective July 1st of this year. I was able to get these slides. They were loaned to me by the Virginia Health Catalyst. Next slide, Charlotte. The Virginia Health Catalyst is a coalition of dental and medical providers, advocates, community partners, representatives of state agencies that have come together and have worked on a variety of oral health issues, and it was formerly called the Virginia Oral Health Coalition. Next slide. The Virginia Health Catalyst was actually successful back in 2015 in getting a comprehensive dental benefit added for pregnant women. That was added to the benefit that was already available for children. But for adults, the only thing that was available was coverage of emergency extractions. So a lot of older adults would often end up in the emergency room with problems because they had no routine care that was provided to them. Some of them, through the managed care organizations, and there are 6 of those, did have some dental care as an enhanced benefit, but it really was not a comprehensive benefit. Next slide. So the adult coverage that has been added is also a comprehensive dental benefit. It's very generous. In fact, it is equivalent to what is currently being provided for children and pregnant women, and really was even more than what the Virginia Health Catalyst had hoped to achieve with the legislation that just passed. Next slide. And as you know, oral health can have a major impact on chronic disease outcomes, especially things like diabetes and heart disease. And as I mentioned before, when people don't have oral health care, then they do increase their utilization of emergency departments. And DMAS had actually looked at this, and they were spending quite a lot of money for emergency room visits for adults who were going in with dental issues. Next slide. So with this new adult dental benefit, just about everything is covered. It's very, as I said, it's a very generous benefit. It is comprehensive. It provides routine care as well as some root canals, even dentures, which for our older adults has always been a problem, getting dentures covered for that group. Next slide. So it's a little hard to see this slide, but it really does show that the services that are covered includes the routine cleanings and x-rays, fillings and crowns, root canals. There is some periodontal maintenance procedures, dentures and partials, extractions, and anesthesia services. And even though there are some limitations on some of these services that are listed here, it is still a very, very generous benefit for our adults. And this will, particularly for our older adults, this will impact our individuals who are what we call dual eligibles. They're dually eligible for Medicaid and Medicare. And as you know, Medicare does not offer a dental benefit. So for those individuals who also receive their Medicaid services, they will now have this comprehensive dental benefit. Next slide. This program will be administered through DentaQuest, which is the same company that currently administers the programs for children and pregnant women. And DMAS is in the process of adding new dental providers to their lists so that they will have enough providers to serve all of the adults who will be getting this benefit starting in July. Next slide. So this is just a very, very quick overview of what's going to be provided. If you have more questions, you can feel free to contact Chloe Van Zant at Virginia Health Catalyst, and she would be happy to provide more information. And that's all I have. Thank you, Charlotte.
Thank you so much, Kathy. This is a great benefit. I am excited. I'm very, very excited about, because I know how much it is needed. And
it's very interesting because Virginia Health Catalyst, as I said, they got the benefit for pregnant women in 2015, and then they started working on the adult benefit in 2017. So it's amazing that they were successful so quickly, I think. Yeah.
Yes, this is awesome.
Kathy, I have a question. Yeah, it's about the providers. So you said that DMAS is adding new dental providers, and that's terrific. And I wondered if there will be enough providers and how those providers will be accessed. Will it be all through the managed care plans or some other way?
I think it will be honestly through DentaQuest. I don't know exactly, but I think they will contact DentaQuest and be able to access the services there. And DentaQuest will have a list of all of the dental providers who've been enrolled.
It's Harvey. Yes, that's how it's going to go. DentaQuest will be providing the providers. And they're going through the Smiles for Children, which is the provider that they use for Medicaid now in Virginia. And so, but Erica, to your point, that's a question that I have as well. I do know that in some other states where they've expanded the dental, that was an issue when they first rolled it out. So that's something that's going to definitely have to be looked at, because if you can imagine the hundreds of thousands of people now that will be eligible for this adult dental benefit who will want to on day one, try to access this. And we're in the middle of COVID still. So I'm a little anxious about how that's gonna roll out.
Any other question? Okay, so following the agenda, we are going to, it's going to be, in December, we had the benefit of a wonderful presentation by Kelly Wright, Nutrition Programs Coordinator at DARS. She shared some background information on the DARS Nutrition Program, as well as some other programs that AAAs may help with. She also shared highlights from the Virginia Roadmap to End Hunger, particularly as those relate to older adult food insecurity and malnutrition. Kelly is back again with us today to provide an update on a variety of nutrition-related activities, including COVID-19 relief funding, the upcoming Senior Farmers Market Nutrition Program season, and results from a recent DARS survey of AAA directors. Kelly, thank you for joining us, and we look forward to hearing more information on these topics.
Thank you, Diana, and thank you for having me today. So we are going to get started, and as you mentioned, we're going to look at some COVID funding updates I have for you today, some Virginia legislative updates, and we're going to go over the Federal Food Assistance Programs survey results that we conducted with the AAAs, and I have some great news regarding our Senior Farmers Market Nutrition Program. So just to get us started, before we jump into the COVID-19 funding section, I just want to give you a snapshot of what happened to the congregate and home delivered meal programs last year as a result of the pandemic. Virginia served 529,275 meals for their congregate program, which was down 17.6% from 2019. So Title 3C1 is for congregate programs. And Virginia served 2,893,958 meals for our home delivered meal program. And that was up over 45%. And that's categorized as Title 3C2. So last year, back on March 18th, 2020, This was the Families First Coronavirus Response Act supplemental program that was offered. There was $80 million for Older Americans Act congregate meal nutrition services, $160 million for home delivered meal services, and $10 million for the Title VI Native American tribes. DARS and the area agencies on aging received a total of $5,817,310. This was enacted, as I said, on March 18th, and it's effective through 2021. Then on March 27th, there was the Coronavirus Aid, Relief, and Economic Security Act, otherwise known as the CARES Act. These supplemental appropriations were enacted March 27th, and they're effective through 2021. And in this, we have $200 million for Older Americans Act Title IIIB supportive services, $480 million for Title IIIC nutrition services, $100 million for Title IIIE family caregiver supports, $20 million for Title VI tribal nutrition services, $20 million for the elder justice activities, including long-term care ombudsman program, and $50 million for aging and disability resource centers. Continuing the CARES Act money, DARS received a total of $19,356,699, and here's the breakdown. Title IIIB, $4,000,008, Title IIIC2, $11,006,000, Title IIIE, $2,003,000, and the Ombudsman program, $484,000. Next up, on December 27th, 2020, the Consolidated Appropriations Act. This supplemental nutrition funding was released. It provides funding for the federal fiscal year 2021 regular Older Americans Act programming and extends flexibilities provided in the Families First Coronavirus Response Act and the CARES Act. In addition, this supplemental funding is for ACL's senior nutrition programs to assist in responding to the COVID pandemic. This act provides an added $168 million to help states deliver additional meals to older adults. DARS and the AAAs received $4,077,856 in total for their home delivered meals. And then most recently released in March of 2021 was the $1.44 billion COVID relief legislation for Older Americans Act services. There was $750 million for congregate and home delivered meals, $25 million for Native American nutrition, supportive and caregiver services, $460 million for supportive services, which is to be used for existing services to support and facilitate vaccinations for older adults and activities to mitigate the risk of prolonged social isolation and loneliness. $10 million was for the long-term care ombudsman program, $44 million for evidence-based health promotion and disease prevention, $145 million for caregiver services. And here at DARS, we are waiting on these funds and on guidance from ACL on how to distribute. Oh, screen's frozen. Here we go. So shifting gears slightly to the Virginia legislation that occurred this winter that is related to nutrition, this produce prescription program was approved. The legislation directs the Department of Social Services in cooperation with the Department of Medical Assistance Services to convene a work group to develop a plan for a 3-year pilot Produce RX program to incentivize consumption of qualifying fruits and vegetables by eligible individuals for whom increased consumption of this produce is recommended by a qualified care provider. The bill requires the DSS to report on the activities of the work group and the elements of the plan to the governor and the chairman of the House Committee on Appropriations and the Senate Committee on Finance and Appropriations by October 1st of 2021. And DARS was involved in this program being offered. Also, Virginia's legislation loosened eligibility rules for SNAP, which is great news. This is the most significant expansion of public benefits in Virginia since the state expanded Medicaid 4 years ago. The bill opens up the Federal Supplemental Nutrition Assistance Program, otherwise known as SNAP, to an estimated 25,000 additional families, bringing in more than $100 million in federal aid. Virginia has had the ability to expand eligibility for SNAP benefits at almost no cost to the state since 1985. Virginia is one of fewer than 10 states where lawmakers have not taken advantage of the program, according to the USDA. In addition to helping people who receive the benefits, the expansion will also make it easier for the state to administrate public benefits programs by making it possible to automatically qualify people for SNAP benefits when they're approved for other assistance programs like Medicaid and the Temporary Assistance for Needy Families Program, or TANF. So shifting gears again, we mentioned that DARS conducted a survey with all the AAAs to determine their agency's involvement with and interest in federal food assistance programs. The following survey results are based on a 92% response rate from the 25 AAA directors. So first up is the SNAP outreach program. 4 AAAs have a contract to provide SNAP outreach through a partnership between DARS and the Department of Social Services. One additional AAA has a SNAP outreach contract directly through the National Council on Aging. Approximately 1,200 participants per year are being enrolled in SNAP through these 4 to 5 SNAP outreach contracts. This outreach is being conducted through several avenues during assessments and reassessments, through site meetings, public information sessions, radio, print, social media, website, direct contact with prospective clients, with care coordination in the nutrition program intake process. When the AAA does an assessment for services, a discussion about SNAP eligibility happens with the client. If the client needs assistance through Common Help, the AAA staff will walk them through that process or make a referral to the appropriate DSS or a benefits enrollment center. This is where I learned of a new program, this Benefits Enrollment Center. So what is that? It's NCOA's national network of benefit enrollment centers that help low-income people with Medicare to enroll in food assistance, energy assistance, healthcare benefits, and more. In Virginia, there are 2 current benefits enrollment centers, District 3 Governmental Cooperative and Senior Connections. District 3 Governmental Cooperative has several subcontractors, including Mountain Empire, Appalachian Agency for Senior Citizens, LOA in the Roanoke region, New River Valley, and Southern Area Agency on Aging. Continuing our SNAP outreach survey, we found out that 18 AAAs do not have any contract for SNAP outreach. 9 of the AAAs are interested in participating in this contract if funding becomes available. 2 of these 9 AAAs already participate, but contracts need to be renewed. 5 of the AAAs are somewhat interested and would like to learn more about participating in this contract and if there's appropriate reimbursement for staff time. 6 of the AAAs are not interested in SNAP outreach due to the following barriers: staffing, the current state of the pandemic, and lack of sufficient funding. So moving forward with SNAP outreach, DARS is currently updating our contracts. We have met with the Department of Social Services EBT DSNAP coordinator, the DSNAP coordinator, to explore ways to increase the AAA's budgets and participation. Plus, we are exploring additional opportunities to increase the number of contracts through another network resource. And we have provided the AAAs with FAQs related to the new online shopping platform that SNAP users can use. And this summer in Virginia, I understand there's going to be a SNAP restaurant program that will be implemented, and DARS is in communication with DSS at this time on making sure we get accurate information and FAQs to provide to the AAA so that they can share it with their participants. Next up is the Commodity Supplemental Food Program, or CSFP. Currently, 5 AAAs are involved in this program, 17 are not involved, and 13 would like to know more about this program. The Child and Adult Care Food Program is next. We currently have 3 AAAs that participate, and they are Lake Country, Appalachian Agency, and Alexandria. 6 AAAs are familiar with the program, 17 are unfamiliar with the program, 6 would like to learn more about the program, and 5 believe that CACFP would be something that their AAA could benefit from. The Emergency Food Assistance Program is next. There's 11 AAAs that refer clients that are in need of these emergency food assistance to the TEFAP program. 5 do not refer clients, and 7 aren't sure if they do or not. So far, based on all that feedback, I feel like there's a great deal of opportunity to provide more information and get all the AAAs on board to the opportunities and how to refer clients as needed. And next up is the Senior Farmers Market Nutrition Program, and this is the program that I administer at DARS. So currently, as mentioned before, 10 area agencies on aging participate. There's 8 additional AAAs that are interested in offering SFMNP in their service area if funding became available. However, of those 8, 2 AAAs do not have the staffing capacity right now to administer the program at this time, and 6 are not sure if they have the capacity to run the local program. The main barrier for participation in SFMNP is the staffing commitment and uncertainty about that, what that would entail. And so a brief recap of SFMNP and an update. And I'm circling back on my previous presentation. I mentioned that this funding is a federal USDA funding only. There is no state funding for SFMNP at this time. It's an annual grant. It runs June 1st through Thanksgiving. And last year it served over 10,000 seniors. This year, we have $421,000 in food funds, and that's up from last year by $8,100. So that's good news. We did receive expansion money for this program, and we also received it for the WIC program as well. We run both the senior and the WIC FMNP. Say that a few times. So the good news happening this year is the Harrisonburg area will be joining the Senior Farmers Market program. and they're going to target 2 senior housing facilities in Harrisonburg. There's going to be a mobile market in Staten at one of the senior housing facilities. There's going to be a pop-up market at 5 Arlington senior housing facilities. And DARG is forging a partnership with the libraries in Virginia Beach and possibly Chesapeake, where they have mobile markets that are linked to the library's summer reading programming. I'm very excited about this. I did just get off a call last night with the farmers that are involved in this program, and they are going to sign up. So we're excited. So as mentioned, DARS received expansion funding from USDA. So based on the most recent intrastate poverty rates, these 3 AAAs would be next on the list to be offered this program, and that's Peninsula, Central Virginia, and the Crater District. So due to VDAC's staffing capacity, because we have a memorandum of understanding with the Department of Agriculture in Virginia, the plan is this: we're going to bring on CVACL this year, so Central Virginia, the Lynchburg area. We're going to bring them on this year, and then they hope to bring on PAA, Peninsula, and Crater in 2022. So that's exciting news for the expansion of this program. So here's just the map. This is where CVACL is located. So wherever you see a number is where the senior farmers market is represented. So we'll be going into this area this year, and the hope is next year we'll include this entire area and Peninsula as well. And why that's big news is because currently VDACS does not have a representative for this whole area. So if we can bring on the next one that have the poverty rate, that will open, I think, eventually open up a whole new area that could potentially be covered. So I'm excited about that news. And that's the update from my program. Does anybody have any questions for me? Hi, Carla. I see your hand is raised.
Thank you so much, Kelly, for talking with me. Great presentation. Thank you again for the work that you do. I think we spoke last year whenever you gave this first presentation, and I was curious if I understood correctly that the farmers markets, that this benefit only pertains to fruits and vegetables, correct?
That's right. Fruits, vegetables, and fresh cut herbs.
So
Correct.
Is there any desire or ability to, because I know at least in Virginia Beach and the Hampton Roads area, we have some great farmers that come out that bring protein, that bring eggs, that bring meats. Is there any movement forward? I mean, of course, we want our seniors to have fresh fruits and vegetables, but protein puts the pounds on. And just not curious of where that is or what could happen with that. Thank you again.
Yeah, that's an excellent question, and thank you for that. And I agree with you, except it is a federal regulation that this program is strictly fruits, vegetables, and fresh cut herbs. So at this point, it would take, an act of federal Congress to change that. Yes, good question. Any other questions?
Yes.
Go ahead.
Diana, I would like to thank Kelly for all the work you're doing in expanding nutrition program options with the AAAs. We appreciate that. And in terms of the farmer market program, I think that's a program that would benefit all areas of the state. And we do realize that there has to be the eligibility requirement met. But we could encourage other areas to do similar programs using other funding if they're able to do that. That is something that we would like to do at Senior Connections, to have a similar initiative that would give those types of food products to older adults. So thank you so much for your work, Kelly. We appreciate it very much.
Thank you, Thelma.
Thank you. Mm-hmm.
Hi, this is Erica, and I have a question. What exactly is the SNAP benefit, the farmer's market benefit, is it a reduced price, and how does the person pay for that? And I think I read somewhere about the use of SNAP benefits for farmer's market. Could you talk a little bit about that?
Sure, I'll start with the senior farmers market, and if you excuse me, I have a show and tell. So this is what the voucher looks like, and seniors get 9 of these $5 checks in this booklet that they tear out and can use for fresh produce. So they get this $45 amount for the entire season, and they can use $5 a week, or they can spend it all in one stop. So that answers your senior farmers market program. And the next question was about SNAP. Am I right?
Yes.
That's a little, I'll tell you what I know. What I hear from AAAs is that it currently is a very small amount. Like seniors may get anywhere from $16 to $20 a month. Is that right, Kathy? It's a very small amount, and we're hoping that now there will be an increase for seniors, because we know that $16 to $20 a month doesn't go very far. And that's why seniors are resistant, because there's an awful lot of paperwork to sign up for that small amount. So that's definitely what one of the things we're working on.
Yes, and Kelly, I think it's really important for us to promote the use of SNAP benefits and to encourage seniors to apply for SNAP, because the $16 adds up. And just like the $5 voucher for the senior farmers market, they don't have to use it all at once. They could opt to save them for a complete meal or use them for nutritional products. So it really needs to be a marketing opportunity for us to promote SNAP and to encourage our advocates to not say that it's not enough, but to promote it as being something they can use incrementally if they choose to do that. And thanks for your work in that area too. That's very helpful.
And plus, it's my understanding that during the pandemic that seniors, whether they're in, alone or in a household with a spouse, that they're going to be able to access the full benefit amount for SNAP, which is, I can't remember, Kelly, was it like $160, $180?
$180 a month, that's right. So it could increase dramatically for $180 a month.
Kelly, I think Erica's other question too was about SNAP use at farmers markets.
Oh.
And my understanding is that if a farmer is enrolled in the SNAP program, then they can accept SNAP benefits. Is that correct?
That is correct. And plus, throughout Virginia is the Virginia Fresh Match program that will double your SNAP benefits at these certain farmers markets that participate in the Fresh Match. So yes, farmers do accept SNAP throughout the state. It's not everywhere, just like our program isn't everywhere, but it is gaining steam and momentum so that SNAP participants can use their benefits at farmers market, and they can also get those benefits doubled at some markets.
So could I go back to the paperwork issue? Because I think I've heard that somewhere before, and I just wondered if there's anything that we can do to streamline that, because it does seem like a barrier.
I think it's a great question, and it goes way beyond my capabilities, but and I have mentioned this to Kathy, and I think other departments know about it. It would be great, and it may already be happening, if we can combine applications for these food assistance programs, so you don't have to fill out separate applications for all these food assistance programs. And I think there is something like that on Common Health, but Kathy, is that right?
Yeah, I'm not quite sure that if they apply for SNAP, that it automatically makes them eligible for the other programs. There was something that just came out about if they were approved for, I think one of the Medicare savings programs, that they would automatically be approved for SNAP. And I think I just saw that maybe in the last week. So we can find out some more information about that.
That would certainly help streamline is the number of applications participants have to fill out.
Any other question?
I think Carla has a question.
Yes, thank you. Where do seniors go to learn about this program for the farmers market, and how do they apply?
So the area agencies on aging that participate do their own outreach and marketing and promotion. DARS does have it on our webpage. It lists all the AAAs that participate. It doesn't include CVACL yet, because literally as of last night, they found out about this expansion. So they're just coming on board, but we'll get that updated to include CVACL. But it is on DAR's website.
Okay, thank you. And if there's anything that I can do to help in the Hampton Roads area, I have a lot of contacts with the farmers markets and the people that put those on, and other places. I'm always happy to help any way I can.
Thank you. Did you happen to speak to somebody at the library? I think that helped get the libraries on board last night. The farmers markets. That was awesome.
Okay, good.
I thought of you.
Thank you.
We'll be sure to do that. We also provide the AAAs with FAQs, like there's a fact sheet. And so how their care coordinators, whoever's doing any kind of contact with participants, is also familiarizing the participants with this program.
I can also help here in Woodbridge, Virginia. So if you need help around here, Woodbridge, Manassas, I am here. I can help.
Okay. Great. Thank you. Thank you.
Are those facts and are the outreach materials in other languages like Spanish? Just Diana made me think of it.
Great question. Last year, so as of right now, I don't think like the fact sheet is, but we can get that done this year. Last year, we converted all the farmer information, because there's quite a hefty farmer process. There's an application, there's a 6-page agreement, there's a handbook, there's a cover letter. So to bring farmers into the program, and we had that all translated last year into Spanish, so that we got that done. So this year, it's probably time to make sure we convert all the FAQs and information about this program into Spanish. Thank you for that.
Love it. Okay, any other question? Or okay, let's move on. And right now, having heard this wonderful presentation, and I love all of them, and updates, we now have some time to discuss the committee's next steps and any recommendations the committee may want to share with the council or the legislative committee for the council's upcoming 2022 legislative recommendations. The legislative committee will meet this summer to discuss legislative and budgetary items. Nutrition committee member Erica Wood chairs the legislative committee, so she can help liaison between the two committees. Erica, do you want
to? Yes, and I'm looking at the handout that Charlotte sent with the agenda showing various options. And it might be good to run through that. But as far as the legislative committee, it strikes me that at least a couple of these would be really good for this committee to propose to the legislative committee, and for the legislative committee to take that up. I'm thinking of well, there are at least three I see. An easy one would be Malnutrition Awareness Week in October, which is a proclamation or resolution, and it's got no funding involved. So that's very straightforward. On the higher cost side, and then we'll get back to the middle ones, because the Medicaid coverage of home delivered meals is in the governor's roadmap, that might be a really good one for, and it does cost money, of course, but that might be a really good one for the council's legislative committee. So those are my initial thoughts. Also, the same way for expansion of the farmers market would also be one.
Charlotte, any other actions that we need to do?
Well, at this point, you all can decide if you want to put together what you like, a package of things you want to recommend, or if you want to narrow this list and put it forward, or if you want to leave it open-ended, or if there's something you want to tackle next in a future meeting. I think I want to also take this time to shout out to Kelly for all the work that she has done behind the scenes and with her presentations for this. I think certainly we would not at DARS, if it's just been me, been able to get the wealth of this knowledge that Kelly brings, but also the amount of work that she's put into it. Really, really cannot say enough about that in terms of my workload and how she's been such a good, go-getter about this type of work, and we're really glad to have her. So I do want to be conscious of our workload, and it sounds like that DARS is moving forward with some things on our end to try to help the AAAs and provide some technical assistance to them and how they can be further engaged in some of these federal programs, which I do think, we learned a lot in that process during the surveys and our meetings. And we have a new staff member on board at DARS. His name is John Carpenter. He couldn't be here today, but he has some prior work experience with DSS. So he's been really great to have to provide insight as well. And I think that some of these things that DARS will hopefully be working with the AAAs and B4A on can really help move the needle on food security and malnutrition over the next year or so. So, I mean, it's up to you all. I do think there are some activities underway now that will help move that needle. And I will say, I think, as Meredith said, obviously food insecurity has been a real big issue during the pandemic for a lot of ages, but ACL has been giving out quite a bit of federal money to help try to supplement the nutrition programs through the AAAs, and they've really stepped up to help meet that need and get that money turned into food that goes into people's stomachs. And so that's been really great during the pandemic. Not sure what that leaves us when those funds run out, but that's something we're monitoring at DARS as well.
Well, Sean, I think one thing that we need to work towards is to make sure that we can help people find those resources once those additional sources of funding are no longer available. And I think this is a really good list of policy options for the committee to work on. One that I'd like to suggest that we add at some point would be the PR and marketing of SNAP as a benefit for older adults, where older adults themselves, caregivers, family members, service providers get information about how this benefit really helps older adults with food insecurity. We do have a National Nutrition Month where this message could be put out, or it could be put into Older Americans Act, Older Americans Month activities. But again, I just think the notion of promoting SNAP as a valuable benefit will be helpful in the long run in terms of adding additional resources for older adults who are challenged by food insecurity. Thank you.
Harvey, not to put you on the spot, do you know if the managed care organizations and those care coordinators also help with coordinating or getting people connected with SNAP benefits, for example?
So for the CCC plus population, usually the care coordinator would assist with that where it's needed. But based on the fact that the care coordinators, there's a lot of turnover in that situation sometimes. I agree with Dr. Watson on this. I really think a grassroots kind of PR around SNAP benefits and the eligibility, because most people, like for me, being a caregiver for my mother, wouldn't really know exactly how to access those benefits. And then there is sometimes a pride that goes along with people when it comes to some public assistance. So helping people feel comfortable that this is something that they really do need to take advantage of.
Thank you.
Do we need to do any policy recommendations, roll call vote? Erica?
I mean, and maybe Charlotte can weigh in on this, but it would seem to me that we should determine whether we want to forward to the legislative committee those issues on this sheet that are legislative in nature, including as opposed to the PR and marketing, which I think is really, really important. But for the legislative committee, I'm going back to, and we didn't really talk about Medicaid coverage of home delivered meals. And I don't know who would be, maybe we need to find out more about that opportunity, that possibility. But because it's in the governor's roadmap, it seems like we're already on the road a little bit. And it might be a good one for the council to support. That one. And then as far as the, if we asked for legislators to enact, and I don't know if we have to do this legislatively, or Charlotte, you would know, if the Malnutrition Awareness Week, is that something legislative, or is that something that the governor could just go ahead and do? And
so you could do a Malnutrition Awareness Week resolution, which is a General Assembly resolution that would be done one time, and then each subsequent week of the year, that same week, it would be considered Malnutrition Awareness Week.
Mm-hmm.
Or you could do a proclamation submission to the governor's office. So that's submitted to the governor for consideration. And that would be done, have to be submitted 45 days before the week every year, and you could do it every year.
So if it goes through the legislature, then it sort of automatically comes back every year.
I'm sorry?
If it goes through the legislative process, then it automatically comes back each year. Is that right?
It would be in effect each year.
Okay.
Moving forward, but you wouldn't see that legislation again every year.
Right.
Yeah.
Right.
With the proclamation, you're going to get a new proclamation every year that may or may not say the same things, depending on if you want to tweak the language.
Yeah.
Mm-hmm.
I mean, I know it's hard to get these weeks or months off the ground, and I was involved in older Americans, older Virginians Mental Health Month, which is September, and that came back for many years and did do many things, but it does take a while to build up a head of steam so that people think ahead and plan what they're going to do for that week or that month. So there is an advantage, it seems to me, in going the legislative route. On the other hand, there's an advantage in going the proclamation route if it, if there might be needs for tweaks and changes and updates. But to me, it's simplest to do it legislatively, and because it's not a budget item, it might be a good one to get passed easily.
I think that might be something that the legislative committee would want to consider in the context of, especially if you're planning to go forward and ask for the report language to be added to your code section.
Mm-hmm.
Yeah. I think it looks like you have that one. You have the expansion of the Senior Farmers Market Nutrition Program. That could be that would be a budget item.
Yeah.
To provide general funds to supplement the federal funds that are received to provide that full expansion, which Kelly, seems like that might not be as much of a lift as we once thought if we have some areas that are already getting some expansion funds. Is that correct? You're muted, Kelly.
Sorry. It's still a lift
Okay.
because it was just the 8,100 for the one AAA this year. So
Okay.
we can apply for USDA expansion again next year. But it'll still be under $10,000 if I had to guess.
Yeah.
And it depends on how this year goes. I mean, Virginia was very lucky to get any expansion. I think some programs in our region were actually cut in the senior side of things. So it's still going to be a lift, but it's certainly doable, and that would be a great route to take.
And then obviously your Medicaid covered service, home delivered meals would be a legislative, both budget language and I think the budget authority.
Is there someone, Charlotte, who, and maybe this is a question for the legislative committee, who has more details and information about what that would entail and what it would look like? That's certainly not something that I know about. Maybe somebody could speak to the legislative committee about it, or could speak to this committee at some point.
I'd have to think about that. I'm not sure. Obviously, I know that was been included in the roadmap, and I know that's been discussed. I'm not sure if there's an entity that's working on that actively right now. I do not believe that that's something that Medicaid is actively working to pull together.
So
but I could be wrong.
That would be a real heavy lift. It's probably a lot of money, and we're starting from the beginning, even though it is on the roadmap. And
I do think that Medicaid is right now working to roll out the employment services benefit and the housing services
and the
benefit. And so I would assume that those are probably the priority items in terms of Medicaid funding for those services.
Oh, Charlotte, it's Harvey. To Erica's point, that's kind of one of the questions I was looking at with this home delivered meals. Do we set the criteria for this to when we propose it, as far as when we say home delivered meals based on individuals in this particular category, or we just kind of give them this home delivered meals and then the legislative committee kind of unpacks that? How does that work?
Mm-hmm. So the legislative committee could kind of make that recommendation. My thought would be it'd be a more general conceptual recommendation. From a Medicaid implementation perspective, if you did it like an 1115 waiver, which is how the housing and employment benefit, I believe, is being put forward with the Centers for Medicare and Medicaid Services, that has a more narrow scope. You can define it and you can put some budget parameters around it. If it's envisioned as a state plan benefit, then it's a wider catchment area and there's no consideration for the cost of it. CMS has provided some guidance to states on home delivered meal benefits. And for example, one thing that stands out to me is I think that the maximum you can provide is 2 meals per day. 3 meals is viewed as an institutional benefit. And so that would not work for a waiver service for somebody in the community. So there's some guidance from CMS on that. And obviously, I think some states have gone down that route. We have not had at DARS the staff time to dig into this, to be honest. It's a heavy issue and to unpack.
Yeah, because now some of the managed care organizations offer it as a value-added benefit for their members, but now we're looking at not, and this is after a hospital stay. So now we're looking at something that's not really tied to a hospital stay, but it would be some other criteria that would probably need to be explored to see how that benefit would be rolled out. Because it, as Erica mentioned, budget-wise, and as you mentioned, from a budgetary standpoint, I couldn't imagine what that would be from a state standpoint to roll this out to all of our CCC Plus members potentially.
Yeah, and I mean, it's also a value-added benefit for some of the Medicare Advantage plans. So I think that as these managed care companies are stepping their toes into that water, there might be some increased confidence about how to add those voluntarily and manage it in a wider scope.
Well, I'll say it's definitely something that's needed. I mean, I was able to work with the Senior Connections when they did one of their meal distributions last fall, and this whole issue with people not having transportation and needing to have something delivered to their home. It's really particularly for older adults, that barrier that exists, whether they're in a metropolitan area or they're out in the southwest part of the state. This is really something that's vital.
I agree with Harvey because I mean I see the same thing. I mean I sell Medicare Advantage plans and definitely transportation and meals is something that people really need. I mean that's great. Any other comments, questions?
Well, going back to our relationship to the legislative committee, can we, or do we need, I don't know if we need a motion or not, but it seems as if we've outlined 3 possible options for legislative. One is on the easier side, one is midway, and the other, the Medicaid coverage, is the hardest. But it might be beneficial for the legislative committee to discuss all 3 of those. I don't think that they're going to adopt 3 items having to do with nutrition, but nonetheless, they might want to know what's on the radar screen so that they can weigh it themselves.
Erica, you might add to the list if you wanted to add this PR and marketing campaign for the SNAP, that probably would, I'm assuming, be something that would need to have some funding behind it.
So, yeah, and I was thinking that might be, might or might not. It could be connected with the Malnutrition Awareness Week. Not that it would only be that week, but maybe the item would be PR and marketing. Well, but that's for the farmers market. So that could be a fourth one. It could be especially marketed during the awareness week. But yes, I guess that's a fourth. You're right.
So would you like to make a motion to provide these four to the legislative committee as recommendations from the nutrition committee?
Yes, I make that motion to, do I need to rename?
No, your confirmation there is good. Is it?
Okay.
Is there a second for that motion?
Me, I second.
Is there any further discussion? Hearing none. Diana, if you're okay, I'll call roll call vote on this. Harvey?
Yes.
Aye.
Carla?
Aye.
Diana?
Aye.
And Erica?
Aye.
So I can work with Diana to pull this list together and Erica in a format that would be beneficial to the legislative committee.
Okay. Thank you, Charlotte.
Oh, thank you. This was awesome. Okay, without any further items on the agenda, I will now like to adjourn the meeting. The next full council meeting date is going to be April 28th, 2021 from 9 a.m. to 11:30 a.m. At that meeting, I will provide a brief update on the Nutrition Committee's work. We don't need a motion to adjourn the meeting, but any comments or questions? I thought it was great. I love the presentations. They were amazing. So thank you so much, all of the presenters. They did an amazing job.
And thank you, Diana. You've done an amazing job.
Thank
I
you.
really appreciate it. It's very, very well done. Thank you.
Thank you. Thanks, Charlotte. Okay, guys. Thank you so much. I appreciate it.
Aye.
Bye.
Aye.
Thank you.
Bye.
Bye.
Bye.